Arterial hypertension is a medical condition where the blood pressure is persistently raised, with an increased risk of heart attacks, strokes, chronic kidney disease, peripheral arterial disease, and vascular dementia. Hypertension affects 1 in 3 adults worldwide, though this figure may be as high as 2 in 3 adults. Primary hypertension, which is the majority of people with high blood pressure, does not have an identifiable cause. Secondary high blood pressure occurs in 10% of people and can be caused by an underlying disorder or the use of certain drugs. Hypertension can be seen when systolic blood pressure is sustained at or above 140 mmHg. Diastolic is sustained above 90 mmHg or both. The diagnosis is then confirmed with either ambulatory blood pressure monitoring, ABPM, or home blood pressure monitoring, HBPM. While you are waiting for a diagnosis of hypertension, investigations to assess for target organ damage and secondary causes should be implemented. In addition to the above, a cardiovascular risk assessment should also be offered. Hypertension is classified into 4 categories. Stage 1 hypertension, clinic blood pressure anywhere from 140/90 mmHg to 159/99 mmHg. Subsequent ABPM or HBPM daytime average blood pressure ranging from 135/85 mmHg to 149/94 mmHg. Stage 2 hypertension, clinic systolic blood pressure of 160/100 mmHg or higher, but less than 180/120 mmHg, and subsequent ABPM daytime average or HBPM average systolic blood pressure of 150/95 mmHg or higher. Severe hypertension, a clinic systolic BP of 180 mmHg or higher, or a clinic diastolic BP of 120 mmHg. Acute or malignant hypertension is characterized by a drastic rise in blood pressure up to 180/120 mmHg. Signs of retinal hemorrhage and or papillary edema are found, often accompanied by headache, heavy sweating, palpitations, dizziness, or convulsions. Acute hypertension needs treatment with urgent high blood pressure drugs. Doctors diagnosing patients with hypertension apparently do not always get it right. A new study found that this condition, and that is not detected in most non-hospital settings, is actually called white coat hypertension. The following referrals should be arranged for people who want a same-day assessment from a specialist. A blood pressure of 180/120 mmHg and higher with signs of retinal hemorrhage, papilledema, or life-threatening symptoms such as confusion, chest pain, or heart failure is potentially dangerous, and we advise you to seek medical attention as soon as possible. Suspected pheochromocytoma, for example labile or postural hypotension, headache, palpitations, pallor, abdominal pain, or diaphoresis. For all other people with hypertension, management includes providing lifestyle advice, includes providing guidance on diet, exercise, stress management, alcohol consumption, and smoking cessation if applicable. It is essential that the appropriately initiated antihypertensive drug treatment plan begins with a stepwise approach. You may need to talk to your doctor about platelet inhibiting or statin treatment. Monitor them for any effects of lifestyle changes you make, and review them with your physician annually to check their blood pressure, give support, and discuss treatments they may require. Target clinic blood pressures are age under 80 years, clinic blood pressure below 140/90 mmHg, ABPM/HBPM below 135/85 mmHg, age 80 years and older, clinic blood pressure below 150/90 mmHg, ABPM/HBPM below 145/85 mmHg. Postural hypertension. Blood pressure target should be based on standing blood pressure. Frailty or multimorbidity. Clinical judgment should be used.